Wilhelm Conrad Röntgen discovered the X-ray on 8 November 1895. During one of his classes, he noticed something across the room began to glow.
The professor saw an object glowing when his chalkboard-shotted tube was charged. It turned out to be the barium platinohide-coated screen, and he was holding various materials between the tube and screen to test the new rays. He saw clearly his hand's bones display in an outline of flesh.
Thomas Edison developed a handheld fluoroscope while eager to perfect Röntgen's discovery. It was common to find falsified images, and as soon as apparatus became widely available, people were able to produce X-ray images at home. At least that was what they were thinking.
So not only bullets, bones, and kidney stones were exposed by the ray, but it were trained on prevalent diseases such as tuberculosis and malignancies. Thereafter, his efforts were focused to obtain an X-ray lamp for domestic use. However, knowing the unable manufacture for being commercial, the professor developed an X-ray of the human brain that was radiographed in 1896 by H.A. Falk. The professor showed his discovery to the Wurzburg Physical Medical Society. He was awarded the first Nobel Prize in Psychology in 1901.
In 1896, the first angiography, moving picture X-ray, and military radiology images were obtained. For the first time in mainstream medicine, a complex electrical machine, an evacuated glass tube, a generator, and a combination of photographic materials intervened in the physician-patient relationship.
Anatomical planes are flat surfaces used to describe a specific part of the body with vertical or horizontal lines. They are used for radiographic positioning with humans or animals. Some of the anatomical plane's positions are dorsal plane, parallel to the back, transverse plane, perpendicular to the long axis of the body, sagittal, dividing the body to the right and left parts, median, sagittal section on midline dividing into right and left halves. And there are the major anatomical planes: the medial lateral, dorsal palmar, dorsal plantar, cranial, and caudal.
The public was fascinated with the discovery, but the medical world recognized the importance of the X-ray. Soon, bullets, kidney stones, and broken bones were exposed, just like tuberculosis and malignancies.
In later years, X-rays started showing his symptoms, including redness, numbness, epilation, infection, and severe pain, all these effects being associated with irradiation. And although many had noted difficulties with X-ray burns, it was not until the death of Clarence Daly, the long assistant of Thomas Edison in X-ray manufacture and testing in 1904, that observers finally agreed that magic new rays could kill as well as cure.